can I differentiate menstrual period from implantation bleeding? We shall find out from this video. But before we get into this video, if you're visiting my channel for the first time or you haven't subscribed to this channel, please click on that subscribe button below this video and turn on the bell icon so YouTube will notify you anytime I upload great content like this one. And to subscribe is free, so go ahead and subscribe. Okay, vaginal discharge is usually thin, clear or white. However, sometimes the discharge may be other colors like yellow, green, brown, red, and the rest of them. Now, brown discharge could be as a result of many things. For a woman who is not pregnant, at the beginning part of her menstrual period, when the flow is still very light, she might observe that the blood or that menstrual period is brownish in color. This usually happens on the first day of her menstrual period and also towards the end of her period. The bloody discharge may appear dark red or brown in color. It is not something to worry about. Thirdly, some women do spots during ovulation, and this is called ovulation spotting. Other reasons for a non-pregnant woman to experience brownish discharge could be after pap smear or vaginal examination, and also after having vigorous sexual intercourse. For a woman who has missed her period, pink or brown discharge could mean pregnancy. In fact, it is one of the earliest signs of pregnancy, and this is called implantation bleeding. However, every woman may not experience it. Some do and some do not. This implantation bleeding occurs when the fertilized egg implants into the uterine lining. It is usually experienced from week 2 to 6 of pregnancy. Now, the difference between implantation bleeding and menstrual bleeding are: 1. In implantation bleeding, the blood is usually lighter and is only few drops of blood that you see under your underwear. It may not even cover your pants lining. While in menstrual bleeding, the blood flow is heavier. Another difference between implantation bleeding and period is duration. For implantation bleeding, it lasts for a short period of time, from 1 to 2 days or 3 days, while the menstrual period lasts for a long duration of 4 to 7 days. Also, implantation bleeding color is usually pink or brown, while in menstrual period, the blood is bright red. Another difference is that in implantation bleeding, the cramping might just be mild or no cramp at all, while in menstrual period, the cramp is from mild to severe, depending on your cycle. Also, in implantation bleeding, if you use pregnancy test kit or cassette to test for pregnancy, the result is usually positive, unlike in menstrual period, where the result will be negative. Implantation bleeding is nothing to worry about, but if you're concerned about the discharge, then there is no harm in seeing your doctor or midwife. Remember, implantation bleeding takes place around the time of implantation, after you've missed your menstrual period, and sometimes a lady might think it's just normal menstrual period, and she might get confused thinking what she's seeing is her menstrual period. She may not even know that she's pregnant at this time. Every pregnancy is unique, and so is every lady. You may experience implantation bleeding in one pregnancy and may not in the next pregnancy. Also, some women may not even have implantation bleeding as one of the signs of pregnancy. It is still okay. Implantation bleeding is not a problem at all. It stops on its own in few days. All you have to do at this stage is to take pregnancy test if you're not sure that you're pregnant. And also, if you're concerned, you can still talk to your doctor or midwife. You may experience other early signs of pregnancy like nausea and vomiting, also known as morning sickness, bitter taste, food cravings or aversions, and the rest of it. All these are signs of a healthy pregnancy. Now, for a woman who is 40 years and above, brown discharge could be a sign of perimenopause. Perimenopause is the transition period before menopause, when a woman's periods cease. If you're experiencing more brown vaginal discharge, not because of the above causes, that has lasted for a long period of time with bad smell, pain, cramping, itching, then see your doctor, because it may likely be a symptom of pelvic inflammatory disease, sexually transmitted infections, or retained foreign body, example, condoms. It could also be as a result of contraceptives from family planning or polycystic ovary syndrome. So in this case, you have to go to the hospital. Thank you so much for watching my video today. If you have found this video helpful and you would like to watch similar videos from this channel, don't forget to subscribe. Give this video a thumbs up, comment, and also share with your friends. See you in my next video. Have a nice time. Bye.